Having one of the most advanced healthcare systems in the world, the United States presents international registered nurses with a wide variety of opportunities for both personal and professional growth. Registered nurses around the world traditionally have worked in acute care hospital settings, and I'm sure that is what is most familiar to you. In the United States, however, healthcare services are provided in a wide variety of settings that do include the acute care hospital that everyone is familiar with, but healthcare is also provided in a variety of other settings, both in an institutional format as well as in a community setting or an outpatient setting. I'd like to spend a few moments with you just sharing some information about long-term care or skilled nursing care. Long-term care refers to the provision of healthcare services to individuals that have chronic, ongoing healthcare needs such that they are unable to meet their own requirements. Oftentimes, long-term care services individuals later in life or geriatric patients, but the provision of long-term care is not limited by age. It can also be appropriate for adults perhaps that have some serious disability or have had an accident that has left them incapacitated in some way that does require a level of ongoing care that they are unable to provide for themselves. Long-term care provides many attractive attributes that many registered nurses really appreciate. And I'll just want to speak to a couple of these as they are different than what you would be accustomed to working in a traditional acute care inpatient hospital. In that hospital setting, you have the opportunity of meeting many different patients because the average length of stay is anywhere from a few days to maybe maximum a few weeks. In a long-term care setting, you will be caring for individuals on an ongoing basis that may be residents of your facility for a year, 2 years, 3 years, and maybe even longer, providing you with an opportunity to establish some wonderful relationships, not only with them, but also with their family members as well as friends that they may be interacting with from time to time. So the opportunity to establish relationships with the people that you're caring for, get to know about them, get to know about their very interesting backgrounds is something that many nurses working in this setting find to be a most fulfilling part of their working in a long-term care or skilled nursing facility. A common question is, what is the nurse to patient ratio or the nurse to resident ratio? And I think it's really important to understand that those numbers can vary, those ratios can vary considerably depending upon whether we're talking about working in an acute care hospital setting, whether we're talking about working in long-term care or even in home care. In an acute care setting, you generally have patients that have very active acute needs for a period of time, and they tend to require a higher level of nursing care, nursing support, and nursing intervention. As I've said, in long-term care, you're caring for individuals with chronic needs. So therefore, they will generally be individuals that don't require the same level of nursing care on a day-to-day basis as your typical acute care inpatient would. The other difference to take note of is the staffing models between hospitals and long-term care facilities are very different. In an acute care setting, you have care being provided primarily by registered nurses who may be supported by some administrative staff working at a nursing station just to help with various coordination efforts. In long-term care, the registered nurse tends to be part of a team of caregivers that will include registered nurses, practical nurses, certified nursing assistants, along with this same type of administrative support that you would find in a hospital. So in a nursing home or long-term care setting, you would expect to find nurse-to-patient ratios that numerically are higher than what you would typically see in a hospital, but it doesn't mean that you are expected to do 2 or 3 times as much work It's simply a reflection of a more diversified, more comprehensive care team being the normal standard in a long-term care setting. Long-term care provides opportunities for professional advancement, just as working in any other healthcare setting in the United States does. Opportunities would include becoming a shift manager or a department manager, working your way up if that was your intention to even into a management level position of director of nursing, and even perhaps administration if that was one of your professional goals. So as you consider your options for working in the United States, please know that working in an acute care hospital is far from the only opportunity that exists. Long-term care, skilled nursing care is a rapidly growing part of the U.S. healthcare system. Many facilities are being built. Many facilities have been built in recent times, which means that they are very modern, very efficient in their design, and generally very attractive locations, because really it is the home of those individuals that you will be caring for. So as you consider your options, I'd encourage you to seriously evaluate whether working in a long-term care setting or in a skilled nursing setting would be in alignment with your personal priorities, your professional goals, and the HealthStaff team would be delighted to share additional information with you about great opportunities that we are currently recruiting for that would give you the opportunity to pursue your professional career and professional growth here in the United States, working in a long-term care setting.